Hello, you're welcome to my platform. I am Dr. Sandra. I am a medical doctor and a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is dedicated to all the people that are currently residing or are planning to relocate to areas that are cold and humid. These include areas around the sea or areas that experience the winter seasons. It is about the ulcers due to chilblains. Ulcers due to chilblains are fundamentally defined as superficial ulcers that result from prolonged exposure to cold and humid air. However, the temperature of this cold and humid air should not be below the freezing point. The exposure to the cold and humid air essentially causes a narrowing of the small blood vessels, the arterioles that supply the skin to your extremities. For example, the toes, the foot, the fingers, the hands, sometimes the nose and the ears, but essentially and commonly it is your extremities, the upper and the lower limbs. The signs and symptoms that you should look out for in ulcers due to chilblains include swollen itchy patches on the skin of those areas I've told you about. Look out for blistering, pain emanating from those areas. Look out for any tingling sensations, any numbness, any stiffening of the joints, especially in those areas. Look out for any skin changes. For example, your skin can turn from your normal skin color to, for example, purplish and eventually black. Look out for any infection in those areas, especially when the areas ulcerate, when the areas form an ulcer. The people that are prone to the ulcers due to chilblains include women between 15 years to 30 years, people with a lower weight, people that inherently have arterial disorders, for example, peripheral arterial diseases, Raynaud's phenomenon, diabetic patients, diabetes mellitus patients. The diagnosis of the ulcers due to chilblains is essentially clinical. What we do is we take history and we also do clinical examination. During history taking, we have to make sure that we ask you some questions. For example, if you have been exposed to any cold or humid air, cold and humid air. But we also have to ask you if you have been exposed to air that was below, whose temperature was below the freezing point, because this can actually mean that we are dealing with a more sinister, more serious injury, which is called the frostbite. So we have to look out for that because it is more serious. The frostbites are more serious than the chilblains. And during clinical examination, we look out for the things I've told you about, looking out for any swollen patches on your skin, any skin changes, any blistering, any ulcerations. When it comes to investigations, we always investigate you to make sure that you don't have any underlying causes. For example, do your blood sugar levels, looking out for any elevation in the blood sugar levels. Maybe you might be diabetic, you might be diabetic and you don't know, or we also don't know. So we also have to make sure that we take your blood sugar levels. We also do what we call lipid profile because you might be having some dyslipidemias where you have high cholesterol or high fats in your blood, and you might be actually having atherosclerosis, hardening of the blood vessels due to fat deposition in the walls of the blood vessels. So we have to look out for that. We can also do what we call a biopsy of the ulcer, making sure that you don't have any cancers in that ulcer and we are unaware. The management of this ulcer is essentially home care, medical, and sometimes surgical. During home care, it is now about you to take care of yourself when you're at home. So what we recommend is that you do a rewarming of these areas, making sure that these areas are kept dry, clean, and warm. And during the rewarming of these areas, we recommend that you do a slow, gradual, and gentle rewarming. And before you do this rewarming, we recommend that, for example, if you have been at work, you first wait and get home. Don't do the rewarming from work, because when you do the rewarming from work, you might re-expose yourself along the way when you're coming back you're commuting from, for example, your workplace to your home. So we recommend that please first get home and do the rewarming, because rewarming and re-exposing to coldness can cause more damage. So when you're rewarming, first get home, use lukewarm water with some antiseptic agents, and you should do this rewarming for at least 30 minutes. We recommend that the first time you do the rewarming, you make sure that before you finish the procedure of rewarming, those places should not be hard anymore. For example, when you get exposed to this coldness, you can get hardening of those areas. Make sure that it is now soft, there is no stiffness of the joints, the areas are movable. And of course, make sure that the places are clean and dry. For example, if you have any ulcers going on, please make sure that, or any blisters, please make sure that those areas are covered with the dressing so we don't introduce bacteria into those areas. The medical management entails antihypertensives, for example, the calcium channel blockers. For example, nifedipine is employed to make sure that we cause a widening of your blood vessels, vasodilatation, so that that place can get blood supply. Some doctors employ corticosteroids, but some don't, because some studies recommend we don't use any corticosteroids, but some studies also show that it actually can help in those patients. The other thing that we can do is surgical. We can do some debridement sometimes if there is any tissue loss due to death of the tissues. So that is what we do essentially during the management. And when it comes to prevention, please make sure that you wear clothes that are loosely fitting, especially use them in layers. For example, you can first put on a layer of clothing and then you put on a jacket, a warm jacket, or a warm suit, a warm coat, a trench coat. You can as well put on a hat that covers your ears. You can also use a scarf and use mittens for your hands. We recommend mittens. Mittens are better than gloves, by the way. Also use boots, warm boots that are water resistant. They should also be loosely fitting. And of course, you also use socks that are loosely fitting and woven or cotton. They will keep you warmer better. The other thing that you should do is make sure that your workplaces are warm, your homes are warm. Keep those areas warm, especially the hands and feet. Please keep them warm, clean and dry. The other thing that you can do is please avoid smoking. Smoking can predispose you to chilblains, by the way, because smoking, the nicotine in the cigarettes can actually cause a vasoconstriction, the narrowing of the blood vessels that supply blood to your extremities. Please make sure that you don't smoke when it is cold, because you can become someone that is at risk of getting this condition. Yeah, so that is what I had for you. Thank you so much for listening to me. Thank you so much. For those of you that have subscribed, thank you so much for subscribing. Thank you so much for sharing my videos. Please continue sharing my videos, continue subscribing, continue liking my videos. Share to all your social media platforms. Share to all your loved ones. Please also click on the notification bell such that you can get notified when I upload a video. So I'll see you in my next video. Bye.